Imagine you're a nurse who notices something wrong during a patient's care, but you're afraid to speak up. Maybe you fear being dismissed, criticized, or creating conflict. This silence could be dangerous. But what if we could change that? A groundbreaking study from India shows that simple training can transform how nurses communicate, collaborate, and ultimately protect their patients. Psychological safety, the ability to speak up without fear of punishment or humiliation, is the invisible foundation of quality healthcare. Yet most nurses never receive formal training on it. Picture a typical hospital ward, nurses juggling intense workloads, emotional stress, and life or death decisions. Without psychological safety, concerns go unvoiced, errors go unreported, and the entire system becomes more fragile. The COVID-19 pandemic made this crystal clear. When nurses feel unsafe psychologically, patient care suffers. Researchers at a district hospital in Ranchi decided to test a solution. They took 100 nurses and randomly divided them into two groups. One group received comprehensive training on psychological safety through interactive presentations, discussion modules, and educational materials covering everything from what psychological safety means to practical strategies for creating supportive work environments. The other group? They received no training, serving as a comparison. The results were remarkable. After just 10 days, nurses who received the training showed dramatic improvements. Their knowledge scores more than doubled, jumping from 8.44 to 17.94 out of 20. But even more striking, their attitudes shifted significantly, with scores climbing from 33 to 43 points. Meanwhile, the control group showed minimal change, proving it was the training, not just time or attention, that made the difference. Think about what this means in practice. Nurses who understand psychological safety are more likely to report errors, question unsafe practices, and collaborate openly with colleagues. They experience less burnout, greater job satisfaction, and ultimately deliver better patient care. This isn't just about making nurses feel better, though that matters enormously. It's about creating healthcare systems where speaking up becomes second nature, where every concern is heard, and where patient safety is genuinely prioritized. The study's message is clear. Psychological safety training works, and integrating it into every nurse's professional development could save lives. Sometimes the most powerful intervention isn't a new drug or technology. It's simply teaching people that their voice matters.